Hello, I'm Jennifer Martin, host of Franklin County Home Health Agency's Where the Heart Is. Franklin County Home Health Agency is a nonprofit organization that has been providing services to people of all ages throughout Franklin County since 1969. While its programs and services have grown dramatically since its beginning, its commitment to our community remains as strong as ever. We are proud to bring you this show, which is dedicated to educating our community on the services and benefits of home health care and to bring you valuable wellness information to help you stay safe and healthy at home. With me today are two professionals from Franklin County Home Health Agency, Nancy Dulude, the Hospice Volunteer Coordinator, and Traci Osterhoudt, one of our medical social workers. Thank you for joining me today, ladies. And today we'll be talking about a new statewide education initiative called Start the Conversation. Start the Conversation is a campaign designed to give consumers the tools necessary for early planning on how they wish to be cared for at the end of life or when faced with a life-threatening condition. And this campaign also stresses the importance of talking to your loved ones and family and healthcare provider and making sure that they know your personal wishes as well. Franklin County Home Health Agency is proud to be a partner in this effort, along with the other home health agencies in Vermont and visiting nurse associations, as well as the Vermont Ethics Network. We will also be talking about hospice and palliative care, which are two programs that Franklin County Home Health Agency offers for people faced with end-of-life or life-threatening conditions. So let's start the conversation, shall we? I like that name. Tell me a little bit about maybe where that name came from, why it's called Start the Conversation. What's the importance of that?
Well, many people feel very shy or uncomfortable about talking about end-of-life care, and so the idea came about to maybe talk about the advanced directives and advanced care planning over having a cup of tea and trying to make it feel more comfortable. And if you're more comfortable and you feel safe, you're more likely to share how you really feel.
Sure. What other things make it difficult in our culture to have this conversation about death and dying? What sort of things prevent us from having that conversation early enough?
I think a lot of times people are scared. It's not an easy conversation to have. It can be quite emotional, and I think we tend to try to protect ourselves from that as much as possible, so it can make having these conversations very difficult, or people avoiding having those conversations when that's the most appropriate, most important time to have them.
Sure. As we see in these flyers, we do plan for major life events in our lives for birth. A big popular thing right now is birth plans. You go into the hospital with a plan in hand. We plan for years for our marriage and retirement and other major life issues. So it is it's odd almost that we don't as a culture really talk about death and dying, because it is such a part of our lives, and it has so many impacts not just on ourselves but our family and everybody around us. So it's very important that we have these tools in place for ourselves and our community. So tell me about the dynamics at the end of life that you may have seen with patients or in your lives. What kind of things happen with individuals with either in a life crisis or at the end of life? What kind of things you see in families that they're faced with?
Nobody wants to offend anybody. Sometimes we assume that we know what somebody wants, and that could or could not be true.
And I think as a result of that, sometimes there ends up being conflict within families when they are already going through a very, again, difficult and emotional time, and that conflict can make that much more challenging. And questioning, I think we also see a lot of times folks are questioning whether they're making the right decisions. Where something like the advanced directives can come into play, and they know that the decisions they're making are right because that is what someone has chosen. Sure. So I think all of those things we've seen all of those things among people and can see them kind of cycle through that even.
We keep mentioning advanced directives, and I think we should just clarify exactly what that means for our audience and what are advanced directives and how do people access that and what's involved in planning.
Okay, an advanced directive is a plan for, it covers many things. It identifies folks to have a durable power of attorney for health care, so that identifies someone that can make decisions for you if you're not able to make them for yourself. It develops a plan as to what medical care you would want to receive depending on certain circumstances. It identifies your preference for end-of-life care and identifies what your wishes would be around funeral planning. So it kind of covers all of those aspects, and all can be very important. Some folks choose to fill out just parts of it rather than all of it, but obviously we would always encourage people to really be thinking about all of those areas.
Is this a legal document?
Yeah, it is something that lawyers can draw up. However, people can do them on their own as well. Requires witness signatures, and it is then distributed to hospitals, doctors, family members. There's a registry actually for the advance directives that folks always send them to, so that they are on file and in theory can be accessed by any doctor, is my understanding.
Okay. Where can people find, this is an example of a book that's designed, that has an advance directive form inside it. Where can people access these kind of forms?
Through the Vermont Ethics Network. They have a website. We also keep a supply at Franklin County Home Health Agency, so someone could call and say, I'm interested in doing some advanced care planning, and we could get them the information as well.
Okay. So you talked about a durable power of attorney, or somebody who can make choices on your behalf. What are some people, who should you consider to be your durable power of attorney, or who can be somebody's durable power of attorney?
It can be anybody that you choose. It should be somebody that you have spoken with about what your wishes are, so that they are well aware of what your wish would be, or your desire around medical treatment and beyond. It could be a family member, it could be a friend. I've seen folks choosing a mix of that. Sometimes they feel that they don't want to put that responsibility on a family member and feel a friend would be more appropriate. Other times individuals want their families making those decisions. It really needs to be someone who can stand up and be your voice, and not everybody can do that. So it's got to be someone who can really make sure that hospitals, doctors, family members are following what your wishes are.
Okay. Can there be more than one?
They actually recommend doing, having an individual identified and having an alternative as well, and you can list as many beyond that as you wish. But yeah, absolutely, there can be more than one.
Okay. Are people having these conversations early enough? When is an appropriate time to think about this and to actually complete an advance directive?
Well, it's better to try to plan before an emergency situation comes up, or before you become ill. It's good to plan while you know what you might want to do before you have to make an immediate decision.
Yeah, I don't know that there's a too early with this type of planning. The reality is a form like the advance directive can be completed, and obviously we change through our lives, and our opinions and what our wishes would be may change as well, and the forms can be changed.
So in the event?
Yes, absolutely. If you do them in your 30s, when you're in your 50s, you may not feel the same way, and a new form can be completed representing what your new wishes are, so it can be changed at any time.
It's all about your own personal wishes, so of course those do change through time, and you would just complete a complete new form and sign it and make sure it's filed in all the right places.
Redistribute to exactly the same people you did previously.
Okay. Sure. Can I ask a personal question and ask if either of you have done an advance directive or started this conversation with your family?
I have. I was first introduced to the advance directives when I took the hospice volunteer training, and that was 6 years ago maybe. And so I thought about it, talked with my husband about it. We were, like everybody else, a little resistant. And then about 5 years ago, we took our first vacation together away from my children. And I thought, oh my goodness, we're going to be together. We're going to be on an airplane. Anything could happen. I want to know that everything is the way I want it to be. So not only did I do one, but I got my husband to really be thinking about what he would like to have done as well.
It makes me think, Nancy, though, when you say you wanted to make sure everything was done the way you would like, what is the difference between an advance directive and a will or a living will?
Well, the will would, and I have one of those too, where I wanted to make sure that my children were taken care of, who was going to take care of them. The advanced directive more towards the health, what your health condition would be and what you want in healthcare planning, as opposed to the overall, like who's going to get my house, who's going to get my diamond, and things like that. And I think I started off maybe because it can be kind of intimidating to do it, but I think even if people either think about what you don't want, sometimes we're more clear about I don't want this than we are about, well, I think I might want this. And it may take you a few weeks or a few months to actually come to the conclusion of exactly what you want or what you don't want. And I take comfort in that. I went on vacation knowing that if something happened, people would know what I wanted to
how
do.
you wanted to be cared for. I think, and you bring up a good point too, is that you were going on vacation, and one of the concerns was having this in place in case there was a catastrophic event in your life. So it may not be when I'm aging and I'm dying, or when I get an illness and I'm dying, I'm prepared, but it could be that I'm prepared for an accident or for something that might happen to me at a younger point in my life. So that's an important thing that you've done with your family. How about you, Traci?
I have not done one for myself. I have been thinking about it. Actually, currently I'm in the process of assisting multiple family members with completing theirs. So we're working that way, but we haven't done it, but have spoken, and I recognize that it is something that needs to be done. We just have not gotten around to it.
Can I ask how you started that conversation? Just to give sort of maybe like a role playing or something, to give people an idea of how they can start this conversation if they're feeling uneasy with their family, who they might start the conversation with, and what tools might they bring to that table?
I think to start that conversation, they first of all to pick someone who they feel they can be most comfortable with, especially if they're feeling afraid or anxious about it. If they could find someone or pick someone that they might be able to ease into, it would be maybe my suggestion. And sit down with a cup of tea, like we talked about, and make it more of an interaction versus going through and trying to make decisions and doing that, being able to talk back and forth and communicate a bit. It doesn't have to be a hard conversation, but I recognize that people often feel that it is.
Yeah. I think you can, we do, just to show here some of the visuals, we had the tea here because it is a nice idea. We have, through the agency, we'll be offering some little packets of tea and a gentle reminder that you might want to sit and have a conversation, a friendly conversation with somebody you're close with, and just start the conversation. You don't have to sit down with a form and get ready to make any decisions, but I think it's, as they talk about in this campaign, it's really a gift to say to your family, I want to ease some of these questions and some of the pain during this time, so this is my way of giving you that gift so that you would know what my wishes are, and then ask them the same kind of thing if they've done that with their family. I think it's important to do that. We talked about in these forums, it walks you through things you might want to consider, what you don't want. I think, what are some examples of what people might need to consider at the end of life? What kind of care is available? What are they considering? Feeding tubes, or getting all the care they need to sustain life, or choosing another option? What's some examples that people need to start, or that they will be faced with when they read these, that they need to consider at this time?
IV fluids, feeding tubes, like you were saying, ventilators, respirators.
Whether folks want CPR done, and then it moves into areas of, again, of end of life, and would you choose to be at home or in a different setting? Would you choose to have hospice care versus not?
Traditional care.
It goes into all of those areas.
Okay. So a lot of those medical terms and things can be, scary, or just not know enough about them. So again, not just to involve your family, but you want to involve your healthcare team and your physicians in this conversation. So.
Absolutely, and I would encourage people, if they are trying to fill out forms like this and have questions or are not sure about anything, to ask questions. Get that clearly defined before they're checking checking anything off as to what they do and don't want. Make sure that they have all the information to make those decisions.
What are the risks and benefits to that?
Absolutely.
I guess even with that said, some of those things they won't know until the situation. So you don't have to know it all right now. You don't have to put it all in here, just what you do know you want and don't want. And then as you continue with conversations with your physician, if you develop a condition or something, then you start asking those in-depth questions about what is available to me in this position. And you can update your care plan at that point as well. What happens in the case of an emergency and you're at home and an ambulance has to be called or something? Do they follow the advanced directives?
They have their protocol that they need to follow, which could include doing CPR on people.
And I think that is one of the common misconceptions maybe is one of the areas in here. One of the questions it asks is if you would like to have CPR done, and unless there is a doctor's order saying no to CPR, my understanding is the rescue squads are required to complete CPR until they've transported to the hospital.
So in that event, something for people to consider is that in addition to having this for your care plans, if that's your choice, you need to have a separate document. Talk with your doctor about that.
Do not resuscitate order from your primary care physician stating CPR should not be done.
Sure.
Yes.
Okay. And we covered where you should keep these. I suppose you can keep a copy at home and with your physicians and on the registry. Again, where do you access the registry?
It's through I believe you can get through the Vermont Ethics. However, it's a medical registry. It's where doctors can.
They would do that for
doctors
you.
and hospitals can access, so that if somebody comes in and they don't have a copy of their advance directive, they should be able to access this registry to review what they are. It's not necessarily something that you or I would be able to access, but more the medical.
Okay. It's nice to know it's there and somebody can find it.
Yeah.
We also talked about options, and you mentioned some of the options of whether you'd want to stay home and what kind of care you'd like. And Franklin County Home Health Agency does offer 2 special programs in that situation: the palliative care program and hospice. So let's talk a little bit about what palliative care means, what that is, and what hospice is, and some of the similarities and differences in those 2 programs.
So palliative care would be for someone with a life-limiting illness who maybe has some pain and symptom management control problems or shortness of breath that is not easily controlled. So it is a team approach, and we do have multi-disciplines going in and taking care of people.
So palliative care being that pain and comfort measures, which hospice also provides, and a team approach can continue on. You don't necessarily have to have an end-of-life diagnosis with palliative care, or you may have